Have you ever heard about ataxia? It's not a term you hear every day, but it's a condition that's worth understanding. Ataxia is a neurological condition, a kind of brain disorder that affects a person's ability to coordinate their movements. Imagine trying to catch a ball, but your hand just doesn't seem to be able to meet it at the right time or in the right place. That's a glimpse into what living with ataxia can feel like. This condition is not as commonly known as, say, Alzheimer's or Parkinson's, but it's just as significant. Why is it essential to know about ataxia, you ask? Because knowledge is power. Understanding ataxia can help us empathize with those who live with it and can also guide us in early detection and treatment. After all, we're all in this together, navigating the complex world of human health. Stay tuned to learn more about this not so commonly known yet significant condition. Ataxia, in simple terms, is a lack of muscle control. This lack of control can manifest itself in a variety of ways, affecting voluntary movements such as walking, picking up objects, or even swallowing. Imagine trying to perform these everyday tasks, but your muscles just won't cooperate. That's what it's like to live with ataxia. Now, let's get a bit scientific. Ataxia is not a disease itself, but rather a symptom of an underlying condition. Most commonly, it's associated with issues in a part of the brain known as the cerebellum. The cerebellum is like the control center for movement. It helps you coordinate your actions, maintain balance, and ensure that your movements are smooth and precise. When the cerebellum or the pathways leading to it are damaged, the signals get mixed up. It's like having a faulty GPS system in your car. You want to go straight, but it keeps telling you to turn. The result? Uncoordinated, clumsy movements that are the hallmark of ataxia. But the cerebellum isn't always the culprit. Sometimes ataxia can be a result of damage to other parts of the nervous system, including the spinal cord or peripheral nerves. It can also be caused by metabolic disorders, vitamin deficiencies, or even certain medications. Regardless of the cause, the outcome is the same: a disruption in the smooth coordination of muscle movements. This disruption can range from mild, barely noticeable clumsiness to severe, disabling lack of control, depending on the severity and progression of the underlying condition. It's important to note that ataxia is not a one-size-fits-all symptom. It can vary greatly from person to person, and its progression can be slow or rapid. Some people may experience it constantly, while others may have episodes of ataxia interspersed with periods of normal movement. Now that we know what ataxia is, let's delve into how one gets it. Ataxia isn't something you just catch from the environment. It's not like a cold or the flu that you might pick up from someone sneezing nearby. In fact, ataxia is a complex condition with a variety of causes, each as unique as the individuals affected by it. One of the primary causes of ataxia is genetics. Just like hair color, height, or the shape of your nose, certain forms of ataxia are passed down from generation to generation. This means that if a parent has a specific type of genetic ataxia, there's a chance their child might also develop it. However, it's important to remember that not all ataxia is hereditary. Ataxia can also be a consequence of other health conditions. For instance, strokes, which occur when the blood supply to a part of your brain is interrupted or reduced, can lead to ataxia. The same goes for multiple sclerosis, a condition where the immune system mistakenly attacks the protective covering of nerve fibers in the central nervous system. Cerebral palsy, a group of disorders that affect a person's ability to move and maintain balance and posture, can also result in ataxia. In some cases, ataxia can be a side effect of certain substances or medications. Prolonged alcohol abuse, for example, can damage the cerebellum, the part of the brain that controls coordination and balance, leading to ataxia. Certain medications, particularly those affecting the central nervous system, may also cause ataxia as a side effect. And here's the kicker. Sometimes the cause of ataxia remains unknown. Despite extensive medical testing and investigation, doctors may not be able to pinpoint a specific cause. This type of ataxia is known as idiopathic, a term used when a disease arises spontaneously or for an unknown reason. So as you can see, ataxia isn't a one-size-fits-all condition. It's a vast umbrella term that encompasses a variety of causes, each contributing to a unique set of challenges for those living with it. Knowing the causes is just part of the puzzle. Let's move on to the symptoms. Ataxia manifests itself in various ways. It's a neurological condition that affects coordination and balance, and it's often quite apparent in the way a person moves. Picture a scene from a movie where a character stumbles and sways. their movements seeming clumsy or uncontrolled. That's what it can look like for someone living with ataxia. One common symptom is difficulty with coordination. This might mean trouble with tasks that require fine motor skills, like buttoning a shirt or using a fork. It could also mean difficulty walking or an unsteady gait as the person struggles to maintain balance. Speech problems often accompany ataxia. This is called dysarthria, and it can make a person's speech slow, slurred, or difficult to understand. It's not that the person isn't thinking clearly. It's that their muscles aren't cooperating to produce clear speech. Difficulty swallowing, or dysphagia, is another symptom that can occur. This can make it hard for someone with ataxia to eat and drink normally. It's more than just an inconvenience. It can lead to significant health problems if not managed properly. Finally, involuntary eye movements, or nystagmus, is a symptom that might be less obvious but can be quite disruptive. These rapid, uncontrolled eye movements can make it hard to focus and can severely impact vision. Keep in mind, though, that these symptoms can vary widely depending on the underlying cause of the ataxia. Some people might experience all of these symptoms, while others might only have a few, and the severity can range from mild and barely noticeable to severe and disabling. Remember, these symptoms aren't just quirks or oddities, they're signals from the body that something isn't right. They're clues that can help doctors diagnose ataxia and can guide treatment strategies. Symptoms give us a clue about the condition, but did you know ataxia has different forms too? Ataxia isn't a one-size-fits-all condition. Just like many other medical conditions, ataxia has several forms, each with its unique characteristics and symptoms. One common form is Friedreichs ataxia. This is a genetically inherited condition that typically manifests before the age of 25. It's characterized by difficulty walking, a loss of sensation in the arms and legs, and impaired speech. Ataxia telangiectasia, on the other hand, is a rare neurodegenerative, inherited disease causing severe disability. It affects a number of different systems in the body, including the nervous and immune systems. Symptoms often include problems with balance and coordination, dilated blood vessels, and immune system abnormalities. Then there's spinocerebellar ataxia, a term referring to a group of hereditary ataxias that are characterized by degenerative changes in the part of the brain related to the control of movement, and sometimes the spinal cord. With knowledge about the forms, let's explore ways to prevent ataxia. While ataxia cannot be completely prevented, certain steps can reduce the risk. Living with ataxia is about managing symptoms and making the most out of life. One of the ways to reduce the risk of developing ataxia, particularly the acquired form, is by moderating alcohol intake. Excessive alcohol consumption can lead to damage in the cerebellum, a part of the brain that controls coordination and balance, resulting in ataxia. So keeping a check on your alcohol intake can be a preventive strategy. Another preventive measure is taking steps to avoid strokes. Strokes can damage the brain and lead to ataxia. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and regular health checkups, can significantly reduce the risk of strokes. Now, let's shift our focus to the possible treatments. While there's no definitive cure for ataxia, there are ways to manage the symptoms and improve the quality of life. Physical therapy plays a significant role here. It helps improve coordination and balance, making it easier for those with ataxia to perform daily tasks. Walking aids, such as canes or walkers, can also be immensely helpful. Speech therapy is another effective treatment, especially for those experiencing difficulties with speech and swallowing. It helps improve control over the muscles used in speaking and eating, thus reducing the risk of choking and malnutrition. Medications can also be used to manage symptoms. For instance, drugs that control muscle spasticity can help reduce tremors. Antioxidants, vitamins, and other supplements may also be recommended to support overall health. Living with ataxia is about adapting. It's about finding new ways to do things you love, staying active, and maintaining a positive outlook. Support from friends, family, and healthcare providers plays a critical role in this journey. While ataxia remains a challenging condition, understanding it is the first step towards managing it effectively. Remember, you're not alone in this journey. Reach out, seek help, and take each day as it comes. Let's quickly recap what we've learned about ataxia. Ataxia is a neurological disorder that affects coordination, balance, and speech. It's not a disease in itself, but rather a symptom of various underlying conditions, often genetic. We talked about the various ways one might develop ataxia, including inherited genetic mutations or acquired through conditions like stroke or MS. We recognize the symptoms that might indicate ataxia, such as stumbling, difficulty with fine motor tasks, or changes in speech. We explored the many forms this disorder might take, from Friedreichs ataxia to spinocerebellar ataxia, each with its unique characteristics. We discussed how, while there is no surefire way to prevent ataxia, maintaining a healthy lifestyle can mitigate some risk factors. And while there's no cure yet, we delved into possible treatments aimed at managing symptoms and enhancing quality of life. Thanks for tuning in, and remember, knowledge is power when it comes to dealing with conditions like ataxia. Before we wrap up, we'd love to hear from you. If you found this video informative, please give it a thumbs up and don't forget to subscribe to our channel for more educational content. Your support helps us continue to deliver quality videos that help you understand complex medical conditions like ataxia. Do you have any questions or suggestions for the next video? Please drop them in the comments section below. We value your input and strive to create content that meets your needs. And if you're eager for more, click on the link on the screen to watch our next video on neurodegenerative disorders. Remember, the more you know, the better equipped you are to face health challenges. So, stay curious and keep learning with us. Thank you for being a part of our community. Until next time, stay informed and stay healthy.